similar situations. They didn't have the technology that we have now, so we have the benefit of early knowledge about what's going on around the world. Unfortunately, sometimes things take a bit of time to get going and governments to put things in place, okay? So as citizens, we can be well informed and help protect ourselves and our communities despite what's going on around us, okay? So that's the purpose of today. We really want to make sure that we're still available for the Bomaderry community and to assist those that are isolated. We have an elderly population here as well who are most at risk, and we'd really love to make sure that they've still got connection, although it be from a distance, that they're known and they're seen, and that we can make sure that they have what they need for the duration of this, okay? So we're really proud of all of you guys for wanting to be involved and for staying involved. And we're glad that you all can be a part of this and that we can still serve the community as best we can. Now, the reason that we're doing this training is commonly in an outbreak of any kind, people that pass the disease on are typically health workers, okay, before they know what's happening, because it sort of comes out of the blue. But we're also in a unique position to be able to pass it along as well if we're seeing people and going from house to house and not doing hygiene well, okay? So it's really important that you're aware of yourself, you're aware of the people that you're working with, that we really encourage each other and remind each other to have good hand hygiene, good cough and sneeze hygiene, that sort of thing, and make sure that we're each other's keeper, okay? Because that's what the Bible talks about, being our brother's keeper. This is a great example of this, okay? Help each other remember to have good hygiene and help our community to remember it as well. So some of this might be a little bit above your head, but it will help inform, okay? I've really tried to make it quite easy to understand, but it will help you see the reasoning why we do certain things and the why people on the television are telling you to do certain things, okay? So we're just going to start with some terminology because it can be a bit confusing, all the scientific things and what's going on, what people are saying, okay? So the type of outbreak at the moment is caused by a coronavirus, okay? It's a family of viruses. The number of cold viruses are coronaviruses. But this coronavirus, they're common in both humans and animals, okay? Particularly things like cattle, camels, cats, and bats, okay? So they believe that this coronavirus came from a bat, and that there was an in-between animal, and then it was passed to humans. Now, it's common that coronaviruses can be passed from animals to human, but the problem becomes when that virus then is able to be passed between humans, okay? So that's the issue we have now, is this virus was passed to a human, and a few humans from this market, and then it mutated and became able to be passed between humans, okay? That's why there was a sudden outbreak. So other coronaviruses that you may have heard of were SARS at the beginning of the 2000s, and MERS wasn't as well known here, but in the Middle East there was an outbreak of a coronavirus 2012 and 13. So when someone's talking about coronavirus, they're talking about the actual virus, the thing that causes the disease, okay? What they've named the disease is Covid-19, okay? COVID meaning coronavirus disease 2019. Does that make sense? So when they're saying COVID-19, they're referring to the disease that's caused by this particular virus. Flattening the curve. You hear this a bit? Do you know what it means? So there is, in epidemiology, and when we're looking at the health of a population, we use a curve to plot how many infections there are, okay? And it goes up, and that's the number of infections over time. Okay, when we talk about flattening the curve, what we want to do is slow the rate that curve goes up, because then we won't overwhelm the health system. Okay, if you have a sharp spike like we saw in China and Italy and Iran, okay, the health system becomes overwhelmed because they're already dealing with what they normally deal with, and then all of a sudden we have all these sick people. Okay, so when we're talking about all these things, what we're trying to do is work together collectively to slow the rate of those infections, okay, and flatten the curve. Does that make sense? So one way that we do this hasn't just been invented for this outbreak, okay, but social distancing, all right? So it's a public health tool. It's a non-pharmacological treatment, if you like, to try and flatten the curve. Okay, there's different levels of social distancing, and the idea of it is to reduce the probability that someone with the disease will come into contact with people without the disease. Does that make sense? In a nutshell, that's all we're trying to do, is keep people apart. So there's different levels of it and different measures that they can use. Okay, so one is that 1.5 metre distance when you're out and about, 4 metres if you're inside. School and workplace closures. Okay, so the government's now encouraging people to keep their children home from school if they can, leaving schools open though so that services can keep running that are essential, like healthcare services. Non-essential businesses closing, cancelling mass gatherings, so we're not having church anymore. Closing recreational facilities, so gyms and everything will start to close down. Then we have travel restrictions and border restrictions. So now in Australia, we don't just have an Australian border restriction, we have state border restrictions. Okay, you can't pass from one state to the other. And eventually, if it gets bad enough, they'll cancel mass transit. So you won't have, we've already seen a reduction in plane travel, but they will stop trains and buses if they need to. And then we've got all the steps that we're seeing now. So isolation, quarantine, a thing called cordon sanitaire, which is French, and basically it means that the government will use the military to enforce a population to stay within its area. So the last time I know of this being used was in 1995. They used it in Africa to contain an Ebola outbreak by stationing the military around a town where people were moving in and out of to try and keep Ebola in that place.
They started to do that in New York last night.
Were they? Interesting. With the military? Okay. So that would be a cordon sanitaire, okay? And then protective sequestration is where a community itself decides that they don't want anyone to come into it. So we haven't got the illness, okay? And we're not going to let anybody come in here. So that happened during the Spanish flu. There were a number of communities that decided, well, we don't have the Spanish flu yet, so we're not going to let anyone come into our area. And these towns remained flu-free, basically, but it was basically sort of like a cordon sanitaire, but from the inside out. That makes sense. So just a couple of things that we're seeing here. Quarantine and self-isolation are two different things, okay? You're quarantined if you have been in contact with someone that has the illness, okay? So you don't necessarily have it. You may have been exposed to it by traveling, so they're asking people if you're coming home to stay for 14 days in your house. That's quarantine, okay? It's possible that you have it and we don't want you to spread it until we find out that you don't, and then you can go about your life again. There's also specific instructions for those sharing a home with someone that's quarantined. It gets a bit complicated, but if you are quarantined, the health service can assist you in understanding how the other people live in the same area as you. Self-isolation is when we know that the person has the disease, okay? So it's quite strict. They have to stay at home. They're not unwell enough to be in a hospital, but they have to be isolated, okay? Same as quarantine, there's instructions for people sharing a house with people in self-isolation. Okay, once you get to hospital, you'll be isolated by the hospital in areas of the hospital. But self-isolation is you have the disease, you're staying in your house, okay? So why are we worried about this one? So COVID-19 is caused by a novel coronavirus, novel meaning new. It's just something we haven't seen before. And it's crossed that animal-human barrier and then mutated. It's also mutated again. So there's now 2 strains of it. Viruses are very wily little creatures and they can mutate to avoid extinction basically. That's their goal in life. Now, it has infected hundreds of thousands in the world at the moment. It's somewhere up around 350,000. That's the tests that we know, okay? So for everyone that doesn't get tested, there's probably, so for people that get tested, there's possibly 10 to 50 other people that have it, very mild form of it, that are not going to know exactly that they have it because we're not going to test them for it. Does that make sense? So if you have a very mild form of the disease and you don't meet the criteria for testing because tests are limited, it's expensive, that sort of thing, then there can be, depending on which country you're in, 10 to 50 other people that have the disease than the person that's been tested positive, okay? This is why we're getting a bit cray-cray now, all right? So it means, obviously, that it's quite contagious because there's so many that have been affected in the space of 4 months, okay? 350,000 people have got it in 4 months, plus possibly 10 times more than that. And then in public health, you look at something called an R0 number. That's the number of people a person with the disease can infect, okay? So for something like measles, okay, which is why we vaccinate for it, one person infected with measles can infect 15 other people, okay? So with coronavirus, this COVID-19, they think that this number is about 2 to 3. So if I have coronavirus disease, I could probably infect these 3 here, okay? So in my time with the disease, I'm likely to infect 2 or 3 more people, all right? Now, to make that more related to us, that's influenza. We get every year, okay? We have a outbreak of influenza typically. Someone with a mild to moderate version of the disease, there is close to 14% of people that will have severe illness and require hospitalisation, okay? So that's fine if there's only 20 people with the disease, but we have now 350,000, so it's a lot of people. And just under 5% of them will become critically unwell. That means they'll end up in intensive care. From my contact with other nurses and people around the world on a Facebook group, it seems that once people are in intensive care, very few of them come out. Okay, so once they've got that severity of disease, that close to 5% of people, once they're in intensive care, very few of them recover. Okay, it's like something like 0.2% or something at the moment. So, and also the mortality rate, so the number of people that die out of that is 2.3%. Now this goes up and down because we don't have the full picture yet. It depends on where you are at the moment, where you live, and the mortality rate will vary. It's very hard to figure that out in a new illness, and that still takes a lot of statistics and calculations, and it relies on very good data, meaning everybody that has it has been notified. Now, the reason I say 2.3% is probably because there are all those people that haven't tested. So they do need to take into account that there are probably a lot of other people with it, and that's why the mortality rate at the moment looks like it's 4 to 5%. But if you take into consideration all the people that have very mild form of the disease that haven't been tested, then it probably lowers it a bit. Does that make sense? It's a bit of maths. It's not very exciting, but I love it. Okay, the other thing we're worried about is obviously those most at risk include the elderly and those with pre-existing medical conditions. So things like cardiovascular disease, so high blood pressure, that sort of thing, diabetes, if you're having treatment for cancer, that sort of thing, you're at high risk from being severely affected by this disease. Now, this is a problem here because we have a large ageing population in Australia, okay, and our lifestyle here predisposes us to some of those conditions, pre-existing conditions. So that's why we're concerned about it. So what does it look like? The most common symptoms you have are fever, dry, cough, and tiredness, like you've got the flu, okay? Less commonly, people with severe disease will end up with shortness of breath because it turns into a pneumonia. Aches and pains and a sore throat can happen as well. And then we have a few people in that 350,000 that have said they also had diarrhea, nausea, dizziness, and a runny nose, okay? So basically, if you have anything that looks anything like a cold or the flu, just think it could be that. I won't infect other people by going out in public. The good thing about what's going on at the moment is we're probably going to see a reduced flu season this year because everyone's staying away from each other. This is something that we can do all the time. We can have good hand hygiene, good respiratory hygiene, all that sort of stuff. And we'll see reduced rates of influenza because that's how that passes as well, and the cold. So how's it spread? It's primarily through droplets of saliva. Okay, so when you have this disease, the virus is in your airways, in your saliva and your lung secretions and all that sort of thing. you cough or sneeze, and it becomes what we call aerosolized, okay? So it just suspends in the air on these tiny droplets that you can't see that slowly land, okay? So this is how the cold and the flu spread as well. So this is why we talk about keeping a 1.5 metre distance between you and others, okay? Because if you sneeze or cough into the air, you can actually directly breathe them in, okay? So that's one way you can get it. We ask that you practice good respiratory hygiene as well. So if you cover your mouth and your nose when you sneeze, that will limit those droplets to a closer area to yourself, okay? And it'll end up on your hand or in your elbow, all right? And will protect the people around you, unless you do something else with your hand. I'll talk about that. So if you're using tissues, make sure you discard them straight away, okay? It's a great way of containing the virus, but they're asking that you put the tissue in a closed bin. So don't even just drop it in a waste basket. It needs to go into a bin that has a lid on it. Another way we can prevent it is abiding by social distancing guidelines. That's avoiding unnecessary travel and groups of people. That's why you're all sitting apart. We felt that this was a necessary gathering of people to protect you and others. But unnecessary travel, unnecessary groups of people, don't go near them. And then to self-isolate. So if you're unwell, please stay at home until you recover. That means don't go out. Okay, there's a lot of people that don't really understand this currently. But what it means is do not leave your house. Not to go to the shops, not to go to visit your friend down the road, nothing. Stay in your house, okay? Call people, get them to help you by dropping things off at your door, that sort of thing, but stay in your house until you recover, okay? So this is really important because, like I said, if you're a younger person, this will typically be like a cold to you, okay? It will feel like you've got nothing. But then if you go to the shops with it and you cough in your hand, you put it on that shopping trolley, and then little Marge from down the road comes and uses the same trolley and then scratches her nose, okay, you could kill her. So it's really important, really important. Now, the other way that these types of diseases can be spread is by a thing called fomites. This is basically a funny word that we call surfaces and items that can pick up the virus, have the virus put on them, and then someone else touches them and touches their face. They pick up the virus from the thing, like a telephone or a surface or something, touch their face, it can enter their body that way. Does that make sense? So that's what we call fomites. So those 2 points are avoid touching your face if you can. Yeah.
How long does it live, say, on the telephone?
So there's some new studies coming out now. We thought it was living less than it is. It's now turning out that some preliminary studies are showing it's living for a lot longer than we expected, and a lot longer than, say, the SARS virus did. It depends on the surface type. So they're expecting that it's hours in the air, so it's being suspended for quite some time in the air. Depending on the type of surface, it can live there from anywhere for 2 days to some studies have shown 13 days, depending on what the surface is made out of. So that's why we talk about cleaning things as well. Okay, so when we get to the guidelines, we'll talk about disinfecting areas regularly, disinfecting items regularly, like telephones, keyboards, those sort of things. Okay, big point, the biggest point, the best infection control principle the world has ever seen is wash your hands. Okay, it's the best way to prevent transmitting any kind of respiratory illness to anyone else. Wash your hands regularly with soap and water, especially if they're visibly soiled. If they're not visibly soiled, you can use hand rub, vigorously rubbing them, the same way you would wash your hands, which I'll show you in a minute, you do with alcohol rub. So you need a lot of alcohol rub, and you're scrubbing your hands like you would, okay? It's not necessarily just the alcohol killing the virus, it's the friction, okay, of the rubbing, okay? That's very important.
Sarah, somebody said to me on Sunday, there's no point in using hand rubs because they're antibacterial and this is a virus.
No.
Can you just talk about that?
Hand rub is essential for anything. The main point that I wanted to point out was the vigorous rubbing, Okay, so that's what kills these things. That's what gets them off your hands. Okay, is actually the friction. So people think, oh, I can pump a little bit of alcohol in my hands and just slather it around a bit and it'll be sorted. It's not. Doesn't work that way. There's some studies going on about what strength of alcohol it needs to be and all that sort of thing. But the principle is rub your hands vigorously, whether you're washing them with soap and water or a lot of alcohol rub. Okay, does that make sense? So for your own benefit, seek medical attention. If you have a fever, a cough, or difficulty breathing, okay? Those are the three big things where you would, no worries, get tested straight away and be sorted out. It's really important that the hospital knows that you're coming. They now have a Covid-19 clinic, okay? So when we have outbreaks of interesting things like swine flu and bird flu, we'll often separate the clinic out from, say, the emergency department because there are other emergencies coming in. It can be a bit chaotic and things get missed, okay? So the COVID, do you know where it is, Jen?
Yes, it's because I had to move my office. It's actually, I don't worry about that. It's actually, do you know the old blood bank, the old oncology rooms which are underneath rehab? As you come up the what used to be the main driveway, well they've put it in there, but I don't know whether people.
Shoalhaven Street.
Yeah, so you go in off Shoalhaven Street, the driveway next to the preschool, and it's that first area that you see on the right. Some of you might go to pathology sometimes, which is down behind there. So that's where it is, but I'd be ringing first.
Yeah.
Make sure you ring first, okay? Because also you don't want to go there for no reason. They have quite strict criteria about who they're going to test and who they won't. All right, and so they want to know that you're coming and whether it's worth you coming or whether you should just stay at home and self-isolate until you're better. Does that make sense? But if you ever have difficulty breathing, especially if you have a fever and a cough, please call the number and go. If it's an emergency, like you're really struggling to breathe, call an ambulance, but let them know that you have these symptoms, okay? And they'll come prepared. Does that make sense?
Yeah.
It's the same for anyone you're caring for, anyone you're in contact with, that sort of thing, all right? So if you want any more information on what's going on or what restrictions, things you should follow, there's the health website down there, and World Health Organization is also a good one. So I'm going to give a quick demonstration of how to wash your hands. Okay, it sounds ridiculous, but this is something that we learn in nursing school, Nursing 101. You do it multiple times, and someone watches you do it, and then you get pulled up on how you do it wrong. Okay, this is the best thing that really can prevent this thing spreading. So I'm going to show you, it's a bit counterintuitive, but because we don't have water and whatnot, it's a very good visual. I'm going to use paint. So it is black paint, but imagine that the paint is actually me cleaning the surface of my hands, not dirtiness. Does that make sense? So try and flip that around in your brain, and basically you want to see that your hands are totally covered. Does that make sense? So on your sheets, you've got a little hand wash picture guide. Okay, it's very important. I'm going to move my laptop, and hopefully I won't get paint on myself. That's another good point, actually. If you have sleeves on, okay, they get contaminated. So you notice mostly in the hospital people don't wear sleeves. Okay, you're supposed to be bare below the elbow. Rings are another thing that we don't wear in the hospital. Okay, so just be aware that if you've got a nice diamond ring or something, that they don't get washed properly with a hand washing. So you might need to go home and get the cleaning toothbrush in there or whatever. Or when you're out and about, just what I do at work is I get a big old nappy pin and pin it inside my bra. So that's a good way of keeping your jewellery clean, if that makes sense, and not sharing diseases with other people through your rings. I'm going to put gloves on so that you can see it clearly. These are great gloves. So I'm at my basin and I've the first thing I'm going to do is wet my hands, okay? So I'm turning the tap on, wetting my hands all over. I'm getting my soap. This is my soap. Oh, this is nice. Okay, so I've got my soap in my hand. First thing you're going to do is work up a lather. Just imagine I'm working up a lather with my soap. Okay, then I'm going to interlock fingers. Do the same on the back, both hands. Interlock fingers, interlock fingers. Okay, oh, missed a spot. I'm a bit wrinkly on my hands. So interlock fingers, all right? We also want to clean the tips of our hands, okay? So your nail beds and things, you're rubbing them on the palm of the other hand, okay? And the same with the other one. We're doing thumbs as well. You can do your thumbs like that. What you find sometimes is this bit here gets missed, so I like to do these ones as well, okay? Now I'm pretty well covered, but what's missing? My wrists, okay? People often forget their wrists, all right? These are close enough to your hands to get infected by whatever you're touching, all right? So you're going to go around your wrists like this. Oh look, I missed a bit there too. Okay, so really, this is a really good way of learning how you clean your hands. So if you have gloves and paint at home, have a look and see if you're doing it right, okay? So I would do it a bit more vigorously. The way we learnt at university was we put this glowing cream all over our hands that you could only see under blue light, and then we went and washed our hands and came back and looked. None of us did it perfectly the first time, and in fact it's very hard to clean your hands properly, okay? So they say this should take 20 seconds. Often it takes longer to do it properly, okay? So you can sing happy birthday to yourself. I saw a great video of someone singing Dance Monkey, the Dance Monkey chorus to themselves. That's 20 seconds long. So that's the least you should be doing it, okay? So if you've got visible soiling on your hands, it should be longer than that, okay? But until your hands are completely clean. Does that make sense? Yeah? So that's how we wash our hands. Then we rinse all the soap off, okay? You have to get all the soap off under the tap. Now if you're using paper towels, okay, before you turn the tap off, okay, paper towel, dry your hand, use the paper towel to shut the tap off, especially if it's a turning one, okay? Dry your hands, turn the tap off with a paper towel. Put the paper towel in a bin that you don't have to touch with your hands, okay?
How do you open the door?
So that's the other thing you can do. You can open, if I'm in a public bathroom, I will dry my hands with my paper towel, turn off the tap, and open the door with the paper towel, hold it, and walk out with my paper towel and dump it in a bin outside. Does that make sense?
Yes.
Yeah? So it does take practice to be able to do automatically, all right? So I encourage you to practice, yeah.
What if the bin's having got leaks?
It's okay with hand washing.
Okay.
The issue is tissues and things, yeah. Yeah. Oh, I'm going to get paint all over myself. Okay, does that make sense? That's lovely. All right. So, we're almost done. Oh, paint everywhere. Okay, so now I'll just talk a little bit about some guidelines. Now, these are, just so you're aware, they're subject to change because I came up with them at about 10 o'clock last night, all right? And so after discussion and using them for a bit, this is what happens with New South Wales health guidelines all the time, okay? We do things for a few days, that doesn't work, quick, let's change everything, all right? So if you find that these guidelines are changing, then you'll be notified, okay? And just let me know if you think it's not going to work. So we'll have to change things a little bit the way we do here. I think you've already been doing that anyway. No one's to go into the store. Is that right, Pete? One person can go into the store. Will be allocated to go into the store, okay? So it's not a free-for-all. It's not Oh, they're doing something else, so I'll just pop in. Okay, it's one person is allocated to go into the store and get what's needed at a time, for the whole day, basically, for that time that Salt Store's open, yeah? Let me just find...
What happens if they want to restack it?
Talk to the allocated.
Yeah, talk to the allocated person. The question was, what if they want to restack it? So the restacking should be done by the allocated person.
When they're not serving, someone's serving, they're not serving.
Yeah, we're going to run through that today. I just want to make sure that I'm reading the same guidelines because I've got 2 documents here. Okay. So the first thing, really important, what Salt's known for, okay, continue to be welcoming to our friends and neighbours. Okay, it's really common in a situation like this that people who are unwell become stigmatised and the general population start being a bit nasty and staying away from people and being rude about people, okay? It's not a time for encouraging stigma or anything like that, okay? It's a time where we can really prove that to our friends and neighbours, to each other, we can still be kind, okay? It just looks a little differently, okay? Smiles and kindness don't stop even when we're social distancing, all right? And basically what that means is you just need to be really good at communicating, okay? With your words, communicate clearly to our friends and neighbours what you're requiring them to do at the time, okay? It might mean that you need a microphone or something or someone with a big voice, okay? To just communicate what you're expecting of them each day. So anyone who presents here with symptoms, okay, so they've got a cough, cold, fever, runny nose, sore throat, you need to ask them this. Do you have any symptoms of a respiratory disease, okay, or a respiratory illness? If they do, we have some masks for them to wear, okay? You'll need to explain to them how to put it on and off. There is a video I was going to show you, but it's going to be a bit difficult out here. Do you have the masks handy? And I can just show them how to do it. You're not to put it on them, they do it themselves. You just explain to them how to put it on, and then when they're finished here on their way out, they don't leave with the mask, okay? It goes into a bin with a closed lid, okay? Similar to the tissues. All right, so you get them to dispose of it themselves, okay, and then wash their hands or hand sanitize on their way out, okay? The thing that you need to understand about masks, we don't promote masks for general use because they actually increase the infection rate if you don't know what you're doing, okay? So they're very uncomfortable to wear for anyone that's worn them. They're very uncomfortable to wear. They're hot. You know, within about an hour, they're useless because they're damp from your breathing, okay? So they need to be changed. They're uncomfortable, so you're constantly wanting to touch your face and adjust things, which is exactly what we don't want you to do, okay? So if someone presents who's unwell, they can wear a mask. And if someone presents who's unwell and they're having difficulty breathing, they probably won't want to wear the mask, so you should be wearing the mask, okay? So you wear the mask while you're assisting them, waiting for an ambulance to come. Does that make sense?
And it's as soon as someone touches the outside of their mask,
Yeah,
then
it doesn't work. Exactly. So you can't touch your mask, otherwise your hands are contaminated, basically.
Excuse me, Sarah, be
Yes.
careful you've got that
I know. Oh, great. Can I have a tissue or something? Someone got an unused one. So I'm going to show you just what these masks look like. Oh, thank you. Thanks so much. Am I clean?
No. On your face.
That's right. So, these masks come with 2 bits like this. 2 elastics, alright? Obviously this bit goes over your nose. So they have to put them on. Thank you. I've got plenty of tissue. These are going to be enjoyable to put on. not very comfortable these ones, but basically you don't want to touch your face, okay? I don't need that. I'll just, you don't want to touch your face at all, okay? These are a bit hard to get on. But what I normally do is I put the lower elastic up the top and the top elastic down there, because otherwise they pull into your eye and you want to touch them, okay? The one time you can touch your mask, can you hear me?
Yeah.
One time you can touch your mask is at the beginning, and you're going to pinch that nose bit closed, not closed, but tight against your face, okay? Hand sanitize, that's it. You don't touch it again. It's very uncomfortable to wear, okay? Don't touch it again until you're taking it off, okay? You need to be taking it off in a place where there's a bin and where you can wash your hands straight away, okay? Now, if you've got gloves on, because you're assisting someone, so that's one guideline, we're not wearing gloves unless you're assisting someone who's unwell, okay? You put your gloves on. Once you've got your gloves on, those gloves don't touch anyone else but that person. They don't touch anything else but that person, okay? I'll just show you. Now, when we, this is a very important order of things, and I probably should have put a little step guide on there, but so you've got clean hands, you put your gloves on, okay? You've washed your hands before you put your gloves on. Your gloves are on. If you don't want to touch things, this is a really good way of not touching things, okay? Put your hands together. You're assisting the person, okay? Once that's done, don't scratch your hair, don't hoik your pants up, don't do anything, okay? Once they're ready to go, you go to your bin and hand wash station. You take them off. One, hold it in that glove, hook your finger in the back. Take it off, fire it into the bin. So that you don't have to do that, but I like to do that. Okay, wash your hands. Wash, 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 wash. I haven't touched my mask yet. Wash, 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 wash. All right, dry. Take your mask off. You're not actually supposed to touch your front of your mask. It's going to be very difficult with these masks to not do that, okay, because they're quite hard to get on and off, all right? So I'll try it, but don't judge me if I don't. Where is it?
It's alright.
Okay, try not to touch it. Drop it in the bin, wash your hands again, okay? And then you can sort your face out. Get some fresh paper towel, wipe all the sweat off you. Okay, I'm already sweaty just from having it on that long, okay? So they're very uncomfortable when they're quite claustrophobic, okay? If you're a bit claustrophobic, don't volunteer to be the person wearing a mask and helping the person out, okay? But basically, if someone comes with cold and flu symptoms, all right, you need to be giving them a mask, okay? Just don't hand it to them, don't hand to hand, just place it on the table for them.
Grab the mic.
Say, oh sorry. Place it on the... Don't hand anything to our friends and neighbours, okay, hand to hand. You just place it on the table in front of them and let them pick it up themselves, okay? Same with hampers, okay? I should move in order. So the other thing is we're not, unfortunately, able to do much sort of real connecting here, okay? So once our friends and neighbours arrive, they get their hamper. Please encourage them to head home with it, okay? We can't give them tea and coffee. We can't spend time with them here. If they really need to have a chat to you, move away and make sure you keep your distance from them out here in the bright, open sunshine, okay? And see what they need. If there's any, I don't know if you've got any, let's go down. So witches' hats we're going to place in a line to indicate to those waiting for hampers. So if 10 people will show up at once at the same time and they want hampers, there's going to be witches' hats safe distance apart, and you're to communicate to them. Could you stand by a witch's hat and keep that distance between each other, okay? So you're doing one person at a time and they're not all standing back to back or leaning over you while you're trying to give them their hamper, okay?
Sarah, can I just ask a really dumb question? So Brent and I live together, we go to Woolies and we've got to stand individually. Like, is that, so some of our families, like they come as a family, do they still need to stand
No.
individually? Okay.
Unless one of them's isolated, if that's the case, they shouldn't be at Woolies.
Yeah.
So, or quarantine.
Yeah.
Okay, yeah.
Okay. So
No.
sorry.
So if you live together and you share everything together at home, you can stay together. Yeah. But if they're from different households, they need to stand separately, okay? So yes, if they come with their 3-year-old child, they do not need to stand separately from their 3-year-old. Does that make sense? Okay. Paperwork. I don't know if you've got paperwork or anything you need to be filling out, ticking boxes, anything like that. That's to be done by you and you alone. Don't hand your pen to anyone. If you need detail and they want to give you their contact details or something, you write it yourself, get them to say it to you. Don't give them your pen. Yes? Don't give your pen to other people, effectively. That's a really good thing that you need to disinfect as well, pens. Okay? People tend to put pens in their mouths or scratch their ears or whatever with them. Disinfect the pens at the end of every day. Unless it's yours and you're taking it home with you. Okay, so like I said before, hampers should also be placed in front of our friends and neighbours and then they pick them up. Don't hand them to them. Does that make sense? It all sounds a little bit draconian, this whole idea, but it's really important and we can protect our community by doing these simple things, okay? This is also just the whole way through, just communicate with them. Say, you know, we're so glad that you're still connecting with us. You know, I know this seems a little bit weird, but we're trying to be good examples to our community of how to prevent this illness from spreading. So these are some simple things that we do to make sure that we're not passing anything to you and that we don't pass anything from you to others, you know, that sort of thing. Yeah? So there's no reason for you to wear gloves or a mask unless there's an emergency, someone's fainted or fallen down or whatever, and you need to get close to them, pop a mask and gloves on, like I just showed you. And then obviously good hand hygiene once you've done that, all right? Surfaces and objects should be disinfected regularly and at least at the end of every day. So once all the friends and neighbours have left, please spray and wipe surfaces, items, that sort of things. Yeah?
What should we be using? Spray and wipe?
Whatever disinfectant you've got your hands on. It's better. Don't get caught up in the, oh my goodness, has it got the right amount of alcohol? Because otherwise people don't do it.
Do you need to do warm soapy water and empty soap? Or
No, this is just for surfaces. Yep. Wiping, disinfecting, okay? There is some guidelines, more important for a place like a hospital, but the issue is if you get caught up on, oh, am I using the right thing, then people don't do it. Okay, it's better off you just do it. Okay, then you can wear gloves while you're doing that, okay? Gloves on, spray and wipe everything, and then gloves off, good hand hygiene. Yeah? And then please don't come if you're sick yourself. Please don't come. Okay, this is one of the worst things that healthcare workers do. They're basically being sent home straight away if there's any reason for them to be, like if there's any display of symptoms at the moment. Also, if they've come into contact with someone with it, they're not to come to work, okay? We serve a very vulnerable community. Please don't come, even if you're absolutely certain that it is a cold. I don't know how in this time you could be absolutely certain. But we don't want to pass colds to people, okay? There are people with immune system compromise, okay, that are not going to get a cold the same way you get a cold. So, if you have any of the symptoms listed, please just don't come. As soon as you know you're not available to come, please call your manager, whoever that may be, whether it's Mitch and Ash, Joe, whoever, and just let them know, I'm so sorry I can't come tomorrow. I've got a cold or, you know, whatever. Just please don't come. All right. If you do come and you have those things, be prepared for someone to send you home. All right. It's going to be very annoying to drive here from your home and then get told, I'm sorry, you need to go home again. Okay. So just be really careful about caring for other people in your own illness. All right. And then we're going to utilise our time spent with our friends and neighbours by providing them with health messages and handouts that we'll supply. Okay. So it's a really good opportunity. We do this around the world with public health. If people are waiting to see a doctor, you don't sit in a clinic and not have someone talking at you about the latest health information, okay? So I don't know why we don't do it here. Sometimes, you know, we have posters and things on walls and information that people tend to read. we are fortunate to live in a country where the literacy rate is quite high. However, it's not necessarily the case all in every place, okay? So it's really a good opportunity for if you do have 5 people waiting next to their witches' hats, to give them some health information, okay? About maybe what are the signs and symptoms of this illness, why it's important for you to stay at home, okay? But we'll give you some really simple messages that you can be communicating while they're waiting, and also some handouts that they can take with them. If they pick it up, they take it with them, okay? They don't leave it behind, they don't read it and then put it down again, okay? If we print something out for them to have, they pick it up and they take it with them, all right? Sometimes it's good information as well that they can take home and someone else in the household will read. So there's just a few pictures on the end. So there's really good information on World Health Organization. They've got free downloads of pictures and information, that sort of thing, which Mitch and Ash and Joe and Meg and Pete can use. The other 2 things I included, which I think will be really good for us to hand out to this community as well, is two things that came from World Health Organization. One's coping with stress during the outbreak, because there's a lot of social isolation going on, and helping children cope with the stress, okay? You need to be aware, some of you have small children or are in contact with small children. It's really important to understand that kids pick up on fear, and they pick up on the discussions that are going on in the households or at the store when they're there, that sort of thing. So let's really be positive people and positive influences on kids, and not encourage the fear that they'll already be feeling, okay? It's not something that you need to be afraid of, okay? I want you to understand that there are outbreaks around the world of things all the time, and they're managed by these things, okay? You being well informed is what's going to protect you and protect you from infecting other people, okay? Does that make sense? Nothing is over the top now. It might seem a little bit, and in Australia we're a little bit, she'll be right, mate, it's going to be okay. It's not the time for those things, okay? A little bit of overreaction means that nothing will happen and we'll all be like, oh, what was that for? Okay? That means it worked. All right? If we don't, things get out of control and we'll see what's happening in Italy here. All right? So let's be really good pillars of our community and good examples of how we can do this well, while still serving them essential services that a lot of these people are relying on. Any questions?
When will it end?
When will it end? That's a good point. It'll end when we all work together and get on top of it, basically. So it depends on how well this is all managed by communities as well. Yes? Yeah. Yeah, so if you're disinfecting surfaces, either use something that's disposable, or if you want to use reusable cloths, that's fine. But lots of vigorous rubbing, and they need to be washed regularly. So you once you use them that day, they need to go and get washed. You don't hang them over a thing and use them the next day, okay? Yes?
A bit of a different topic, but belongs here as well. Many people, when they can't get toilet paper at the moment, they use disposable wipes, baby wipes, or what is called flushable wipes. But they shouldn't go in the toilet.
That's true. That's a really good
because
education
they
message
clog
for the
up
community.
the system,
Yeah.
and then someone has to clean it out. So help to avoid that by disposing it in a bin, which is lined with a plastic bag, which then can be closed.
Okay, thank you. That's a really good point. So we're just going to have, Meg's got to just say a few things. So we're going to do a general questions afterwards for both of us. Does that make sense?
Just briefly, I'm aware that we have our Tuesday volunteers here, but we also have people that maybe volunteer on a Wednesday or a Thursday. Can I have a little bit of a show of hands on who plans to be here this week on Tuesday? Today. That's great. That's good. Have a look around, Beck, at your people. Is there anyone here that plans to be here on... this is before you answer There may be a few of you that cross over, but we really want to encourage you maybe at the moment to be volunteering once a week, so we're not tripping over each other, so we're not in each other's space too much. Who plans to be here on Wednesday tomorrow? Okay. Who plans to be here on Thursday? Great. Okay, that seems like a good cross-section of people. And who is willing to do home deliveries? Oh, a lot of you. That's awesome. We only have about 3 or 4 deliveries today, but we anticipate that that will increase. And we want to exercise the same sort of hygiene and safety around home deliveries. So if you are given a hamper to deliver to someone's home, what we're going to ask you to do is deliver it to their front doorstep, and we will send them a message, or their carers a message to say that it has been delivered. You can knock on the door, but we do not encourage you to wait around for someone to answer the door. We actually strongly advise you to walk straight back to your car and leave. And we will get a message to them if they haven't already noticed that you've dropped it off, that we're taking it, that it's on their doorstep. So that's some important information around doing the home deliveries. How we're going to set it up every Tuesday, Wednesday and Thursday is going to be the same at the moment. So we've got some hampers packed, but for those of you that are staying behind today, we're going to have a team of people packing hampers. We're going to space you out outside packing hampers. We're going to have hampers on the tables over here, and one person marking people's names off, not handing their pen to anybody. And if somebody needs to fill in details because they've never been here before, we'll have one other person filling in their details, but keeping a safe distance from people, 2 metres from that person as they give you their details. And that will be the same Tuesday, Wednesday and Thursday. We are not going to hand them their hamper. We're going to have enough hampers from our busy little hamper packing teams to be on the tables, under the tables, for people to come and reach in and grab their own hamper when it's their time to sign in, and then we're going to encourage them to go. We are not opening up our toilets for the general public. They're available for our volunteers, but not the general public. But we're going to encourage people as kindly and nicely with a smile, and we care about you, and get in touch if you need anything. Just not to linger. So that may be the job of some volunteers. And as Sarah has said, we're going to get some health information. So if we see a group of people waiting to access groceries, one of us can go up with some handouts and say, we want to give you a bit of education around your health right now, and hand out information to them, and maybe fill them in a little bit. So it's basic, it's simple. And we're going to encourage you not to linger today. There's no tea or coffee, there's no morning tea, there's pick up your hamper and go. We have other things, other information for people to take away as well. And we're not putting any baby products in the hampers right now, but if you see someone come to the store that has a baby and may be in need of formula or baby wipes or nappies, we do have them in the storeroom. We will need to engage with the person that's rostered on the storeroom for the day and ask them if they can get some for them. But we're not putting it out, just open slather to everyone, because we have limited supplies. But feel free to engage with someone with babies and just say, do you need any supplies or any products right now? Yeah. That's all he was going to say. So that's awesome. Is there any questions? And maybe they're questions for Sarah or they're questions for us.
There will be takeaway meals Thursday.
Yes, sorry. There's takeaway meals being cooked for a Thursday. So we're not doing sit-down meals. We're just offering the hamper and a takeaway meal for people to go. I guess, yeah, and we will leave it up to your discretion, but I think the issue is that we can't trust that the person in the house coming out of the house has the information you have, and then they're not going to want to walk into your space. They're not going to want to engage with you more closely. They're not, maybe they're sick and that's why they're isolating. So we don't know if they're isolated because they're sick or they're simply isolating because they're elderly and they want to be safe right now. So because we don't have all that information, we can't afford to put you at risk. And we can't afford to have you visit someone in their home and then go to the next person in their home and transmit that to someone who's isolating.
Mean to even go to, like, just to stay, like, you and
Maybe at the gate.
you and I could have a
Yeah. What's your opinion on that, Sarah?
I think that's fine. I think what you should also do is encourage them to call I'm assuming the hampers will have salt information in them, and call the number, because Lee has what is it called, a database of people's details and contacts, and then we can start doing things like regular phone ups, and checking on people. Okay, at church we're encouraged to get people's number and check in on each other. It'd be great if for the community we had a database of people, and so if they want that regular contact, it's probably safer for us to do it from here on a telephone, and there can be people that volunteer for that if they want to do that, and just come in of a day and ring 5 or 10 people, probably not 10 if they're old, they'll probably want a long chat, but 5 people, and just see how they're going. Do they have anything specifically that they need? Are they unwell? Do they want to just chat about whatever's going on with their son up in Queensland or whatever? I think that's reasonable. Talking to them through the door is fine, as long as you...
at the door waiting, and then you can hardly drop the box.
No, that's true, but just say, you can do it nicely, put the box down and say, look, I've got a few things I need to deliver today. In there is a number, and we would really love to connect with you. If you want to call us, our office lady Lee will take your details, and we'll make sure that somebody gives you a ring regularly to see how you're doing, and you can have a chat. Okay, because I totally agree, person to person is great.
To have a short chat, not
Yeah,
run off and go.
that's fine, as long as you are aware of the requirements and you stand back. Please do not go into people's houses. The whole point of understanding what fomites are, okay, the surfaces that carry the virus, all in a house, because people don't typically disinfect their house every day. So, just be aware that please don't go into their homes. It's probably not a good idea to go in their homes usually anyway. But yes, if you want to talk to them from a reasonable distance, I'm assuming if they're elderly, they're not going to run down the path at you anyway. But just, that's fine. I'm happy with that connecting, as long as you are maintaining those guidelines. You stay well away if you've touched anything on the property, hand sanitize when you get back to your car, that sort of thing. Yeah.
Might be opening and closing the gate.
Yeah, exactly.
Chances are they've gone down to the gate.
Yeah. No, you can touch the front gate. You just need to have hand sanitizer with you. So whatever you're doing, just be really aware of your own behaviour. So if you're opening the gate to take don't touch your face. Just don't touch your face. Keep your hands away from everything, your pockets, whatever. You can't take people's details. Just say, look, there's a number in there. Please call us in our office and Lee will take your details, okay? Little kids that might want to run out, that's probably something you should be aware of, okay? So in that sense, you might want to, for people, this is only going to happen once, and then we'll hopefully know these people and we'll have the details. It might then require a follow-up phone call. Look, we would love to keep coming to visit you, but to ensure that you don't obviously want to push the kids off or stay back, okay? But just be aware that you then need to, when you go home, take your clothes off and have a shower, okay? So it's quite serious, okay? It's quite serious. And so we don't want you to be afraid or anything like that, but please understand that if you maintain these guidelines, then you'll be safe and the people that you love will be safe. And like I said, Nola, please get their details, call the office, and then we'll just call them again and say, look, next time our volunteers come, could you just make sure that your kids stay inside? We really want to come and connect with you, but we need to make sure that social distancing thing is maintained. Yeah.
You mentioned earlier about the virus going on animals and the like. You mentioned cats. All these places are going to have dogs that are going to be roaming around.
Yeah.
When you come to the gate or whatever and you put things down.
Yeah.
Is it likely to be problems with animals like dogs and things that are around the area?
So the question was whether people's pets or dogs or cats or whatever who come to greet you at the gate will have contamination of some sort. It's quite an interesting topic. Okay, so they're not super sure at the moment. There has been one pet dog test positive in China to coronavirus. They don't get sick from it, so they're not at risk. But the current advice is that if someone's quarantined, they should probably get someone else to look after their pet. Now, what I'm more concerned about in that sense is if someone who's sick inside the house has touched the dog and then the dog has brought it out and you give them a pat. Okay, that's more of a concern to me than I doubt that you being in the presence of a dog. There's no documented evidence to say that a dog has passed it back to a human. One dog has tested positive to a mild version of coronavirus in China. So could be an anomaly, could be, so yes, be aware of that. But typically when these things go on, humans to humans is way more of a concern than animals to humans. Shane.
There's a lot of stuff going around on the internet on how to stay safe, how much do you put into it, and there's also a self-test that you're able to do to test the weird and correct. So does that work?
So look, there's all sorts of things. The question was, is everything that you go on the internet, should you follow about self-care and identifying? One question was particularly the thing about every morning get up and hold your breath, and if you can't hold it for 10 seconds, then you've got coronavirus. Now, I don't know about you, but when I've got a cold, I can't do that and I start coughing. Okay, so no. I think just follow the symptoms. The advice that you should stick to, okay, it's great to read all these things. There's a lot of things going around Facebook. Oh, I got this email from somebody at Brisbane Hospital, okay. I've read that email. It's been posted as different hospitals. The fact, simply I looked at it and went, well, the language is wrong. If it's an internal hospital email, there's no way they'd write it like that. Okay, so things like that, just be aware of. Facebook is really good at people just click and share, okay? Your best source of information are the websites that I've put down for you, New South Wales Health Guidelines and the WHO, okay? So the World Health Organisation's job is to oversee something like this and get information from everywhere in the world, okay? So if they don't have the information, I don't know who does, okay? But yeah, I mean, read what you want on Facebook, but I think the things that you really need to focus on are what has the government told us to do? So what did Gladys say yesterday? What does the New South Wales Health website recommend? And then if you still feel like you need more reading, WHO will give it to you as well, okay? But I also want to encourage you to not be overly consumed by this, okay? There are people who are getting paid to be totally consumed by this virus and the control of it. Don't be that person. You're not getting paid enough money to do it. You just do what you've been asked to do. Manage yourself and the people in your household, okay, as a good family unit, all right? And just know that the reason we tell you these things is for your protection and for the protection of others. You don't need to be afraid of it. We control illnesses with these things all the time. It's just you managing yourself. You have no say over what other people do. You manage yourself and educate those around you using good sources of information, okay?
We might just move any of our additional questions to the side with Sarah, because I know our